pulse oximeter is not helpful if. Hey everyone, this is Daily Dose of Medicine. In this video, we will talk about an important topic. Pulse oximetry does not differentiate between carboxyhemoglobin and oxyhemoglobin. It cannot be used in the diagnosis of carbon monoxide poisoning. Diagnosis is made by arterial blood gas with co-oximetry. Carbon monoxide poisoning can be life-threatening and its symptoms can be difficult to detect because the gas is odorless and colorless. Some signs and symptoms you can see are headache, dizziness, nausea and vomiting, fatigue, weakness, shortness of breath, confusion, blurred vision, loss of consciousness, chest pain. It's important that if you suspect someone has been exposed to carbon monoxide, move them to fresh air immediately and call for emergency medical help because it can be fatal. So it's important to take action as soon as possible. We have a long format video on this topic. Watch that and watch our how to detox pancreas video. See you at the next one.